a leader who strives to translate vision into reality. We are immensely pleased to have our Dean of Faculties and the Chief Operating Officer of SRMC, Dr. Mahesh Vakamudi. May now invite the man of support to deliver the special address. Please, sir.
Thank you, Rohini, for the introduction. Respected Vice Chancellor, some of the eminent and elite panelists who in the healthcare today, the internationally, nationally reputed, Professor Selvam, the Vice Principal Sri Ramachandra, Faculty of Management Sciences, my dear colleagues at the Faculty of Management Sciences, and the delegates who are attending today. It's indeed a great opportunity for me to share some of my thoughts on this topic. When Professor Selvam asked me to speak something, I thought that I instantly agreed because it's something which is very, very close, and we've been working on this for some time now, for the last 9 months. We all know that the COVID-19 pandemic has caused a huge disruption in our medical, social, and economic systems, and it highlighted the need to reinvent our healthcare systems. We were forced to accept and function with lower patient volumes. There are lower margins of profit, less manpower available, but still we are expected to provide the quality healthcare. We are also faced with taking tough economic decisions like layoffs, salary cuts, reducing patient volumes to control personal movement and exposure, making essentials available in time, safe procurement from reliable vendors. All this come under the ambit of administrative decisions that the leader will be required to make. This is an important time in which is not in normal times. None of us have actually seen pandemics. None of us, our healthcare systems have not handled, the current healthcare systems have not handled major pandemics like that. It's such a devastating pandemic. I think we are probably, the whole healthcare system across the world has actually been challenged by this pandemic, probably to the utmost levels. So the hospital administrators should be participatory in their approach, both within the organization and to the public. And when these pandemics of such situations are actually, we are faced with such kind of pandemics, it's actually a warlike situation, and which demands a warlike leadership. As a wartime leader, the healthcare leaders are expected to lock in the priorities and focus on elements with razor precisions. It's very important to understand that you need to, the leadership has to transform an attribute, has to acquire an attribute, a different attribute, which is called a meta leadership. Well, it's very important because you need to, these situations are not normal, they're abnormal, they're very dynamic. The things that happened last week may not be, or what we have been doing last week may not be applicable or right for the next week or next month or something like that. So it's actually very dynamic. So it needed a different kind of leadership. Well, in my opinion, the meta leadership has basically 3 important components. For the sake of the delegates, I would probably mention this. The first important thing is when we actually faced as healthcare leaders, when we are inside this, we first need to understand that the whole healthcare workforce is a different kind of a situation where the healthcare workforce has actually, the whole brunt is on them to take care of the patients, to protect themselves, to be responsible to the society and to the country and to the world in general. When such things happen, it's important for the leadership to buy in the confidence of the healthcare workers and ensure that their safety is their utmost priority. That's very, very important. When the leadership faces such situations, the first response that we have is what is called as a fear, the freeze, fear, and we have basically 3 responses. It's a freeze, that you're normally actually frozen when we actually in the month of, in India at least, we were frozen for some time in the month of March last week, 2nd week onwards. That's the kind of responses that we already have, we always have. That's very natural. The second response that we actually need to definitely possess, is that's a natural response to freeze when we're faced with a crisis situations. But the second response that you must have is what is called a fight response. And you also need to flight. The flight response is basically how you get out of the situation by fighting it out. This is a very important attribute for a healthcare leader to understand and to make sure that the situation and the organizations that are working with are protected. The second important thing I would probably suggest, talk up to the delegates and for this benefit of the delegates is a very important thing. I'll probably give you a small story about a learning or an interesting metaphor. All of us know that in the Twin Towers, in the 9/11 incident, the tragic events that happened. During the time when the accident has happened, the New York Fire Department had a command center at the base of the building, while the police had helicopter actually flying around the buildings. The helicopter could see the steel girders beginning to melt and predicted a collapse, and therefore ordered their personnel out of the buildings. But they were unable to communicate this particular information to the firefighters whose command station is at the ground floor, and they continued to send personnel into the buildings. In all, there are about 343 firefighters lost their lives, while the police only lost about 32. This is an important learning for all of us. This is what is called an unknown knowns. In a crisis situation, you always have what's called an unknown knowns. This is not a normal situation. It's an abnormal situation where the communications are all broken down. So you need to make, as in healthcare leaders, when you're organizing your services in such situations of crisis, you need to understand and look for this what are called these unknown knowns. These unknown knowns are very, very important, and then make sure that how do you actually handle these unknown knowns. You have to ensure there's a communication system that goes up, that goes down, and then goes laterally. This is very important. The lateral communication is most of the healthcare leaders are actually are not used to lateral communications, both internally and externally. Some of them might be used to communications up and down, but not laterally. But it's an important attribute that we need to have. The other third important thing that we need to probably also learn to actually use is have some kind of tools to understand how to handle such situations. One of the such tools is what is called a pop-doc tool. There's a 6-step tool that you actually need to understand to how do you actually go through these situations. You don't need to verbally announce such tools but you can internally work on your minds as the healthcare managers. The first P of the pop-doc tool actually stands for the perceiving. You actually perceive the situations and understand what is it that's actually the situation that you're facing with. The second O, the step 2, is about orient. Once you perceive the situation, you orient yourself to the situations. The third P is actually about predicting what you're supposed to be coming up, and so that you can make your plans. The fourth step, D, is making decisions. You need to go to the drawing board and with your situations in hand, you understand, you perceived, you actually had predicted what's going to happen. So now what you need to do is go to your drawing boards and make sure that you have your decisions right. The fifth step is operationalize. You implement your decisions, and the sixth step is communicate your decisions effectively. The communication is the key, and ensure that it is actually make sure that you're getting information from all across the sources, and you also make sure that your information or your thoughts are actually going to all nooks and corners of your organization. You're connected with all your workforce. So what is increasingly appearing as a grueling marathon now for us may transcend to pent-up demands later once the society opens up. That's another challenge that as a healthcare we're all going to you're going to face, whether it's going to be vaccinations or the locked back surgeries that are the procedures that's actually piled up in the society. All that actually might come as a new challenge for us for the whole healthcare system. The pandemic has shown the world the need for robust and effective administrators and managers to leap forward in a crisis. So it's often said that the crisis brings out great leaders as they band together and convert challenges to opportunities. Let us all actually look at how much we can convert these challenges into opportunities. So I wish the delegates a great meeting ahead for the next 3 hours. We have some of the best thought leaders of the country and international thought leaders in the panel and discussion coming up. I'm sure they're going to give us some enlightening messages. I once again thank and congratulate the Faculty of Management Sciences for bringing up such a fantastic need of our top panel discussion on the topic. Thank you for giving me this opportunity. I congratulate all the delegates for choosing to attend this seminar at the Sri Ramchandra Institute of Higher Education and Research. Thank you.